All right, everybody. Looks like we're live. Episode number 3 of the 5-minute Tele-Physio Talks, the longest title for the shortest interviews. We are here today with Dr. Alex Bue of the Chiropractic Wellness Center of Hudson. Dr. Bue is a good friend of ours and colleague, and he is also one of the best ART practitioners in Northeast Ohio. He is considered an elite provider for active release technique. I'm going to turn this over to Dr. Mike, and we have a couple of the normal questions that we want to go through and chat with Dr. Bue about today.
All right. Dr. Bue, thanks for joining us first off. Our first question is kind of a standard one, and I'll preface it with, we've had the privilege of actually sharing a couple athletes back and forth, but why don't you tell us a little bit about who you are and what type of athletes you are treating?
Absolutely, gentlemen. Thank you guys for having me on. It's a pleasure to get to talk to you guys, even though we have to be at long distances right now. My name is Dr. Alex Bue. I'm a chiropractor and elite provider for active release technique. My office is the Chiropractic Wellness Center of Hudson. My wife and I, Dr. Jen, are business partners and chiropractors that we try to focus on the body as a whole. But some of the things that we do differently is really looking at the soft tissue aspect of what a lot of our athletes and even just regular patients have going on, whether it's muscle firing patterns, whether it's scar tissue buildup in the muscles. Really try to look at the whole instead of just adjusting the spine. As far as what types of athletes, we see a little bit of everything. We get the weekend warriors. We get a little bit CrossFit athletes. Some are just the folks that go to the regular gymnasium throughout the week. Basketball players, wrestlers. I see a lot of swimmers as well. But there's not really one niche that we specifically look for. We just like to use certain screening material and techniques to figure out what each person needs.
Excellent. Very good. Let's look at it from this way then. For the population you're working with, and this can either be in the realm of what's going on with the current health situation and COVID-19 or just in general, what are you doing to help keep those athletes healthy?
So we are big believers in home care, trying to teach patients ways to manage themselves better at home. I tell everyone that comes through my door, we can only do what we do while you're here in the office, but if you can do a little bit at home each day, it helps keep the doctor away. We're real big on teaching patients how to use foam rolling at home. That's one of those aspects that they can use on a daily basis for a minute, a couple of minutes to help keep their muscles and joints moving the way that they should. It's difficult now with the COVID-19 going on. We're open for emergency cases, but obviously our caseload has dropped dramatically. So the fact that we teach patients in office how to do those things, and we've been putting some Facebook videos and stuff like that up of us doing it at home to try to reach our clientele without having to see them in person.
For sure. Yeah, similar situation we've been running into. We've got a few emergency cases where we'll have some patients come in and we're obviously putting on the mask, putting on the gloves and taking care of business as people need it. But yeah, we've been able to jump into a little bit of telehealth stuff, and I'm sure Dr. Tim will talk about that a little at the end. I guess from a third question perspective, why don't you tell us about, I know you said you're big on teaching people stuff at home. Can you give me any specific techniques or things that you find to be really productive to send people home with, stuff that they can be doing now on their own since they don't have the ability to come into the clinic as readily?
Absolutely. One of the little hidden gems we found about a year ago, it's a technique called the reflexive performance reset, which I believe I saw online you guys are dabbling into as well. It's a wonderful technique to teach patients in a nutshell how to keep their muscles firing in the proper patterns at home. If we can reset them in the clinic, that's wonderful, but there's no set amount of time that they will stay reset for. JL is one of the creators of the technique. He runs a big gym down in Columbus called the Spot Fitness Center. And one of his big statements he says is the people that need RPR or the reflexive performance reset or anyone that moves and breathes, which is everybody across the board. There's so many of us that develop improper patterns or compensations that you don't know about it until it becomes a big time bomb that goes off. And we teach patients how to do, it's called wake-up drills at home. And we usually prescribe that 2 to 4 times a day at least, especially in acute cases, to keep those muscles doing what they should be doing. Because as soon as they stop doing that, unfortunately, your brain will give you a check engine light and say, hey, guess what? My hip flexor or my glute is no longer doing what it should be doing. And your body will compensate. The longer that's there, the bigger issues there are. And then we have to do more work on our end.
For sure. Yeah. So you're correct. Dr. Tim and I actually both started watching through the videos yesterday.
I was going to say, I know some of the telehealth stuff we've been dealing with has been a lot with neck pain and headaches from people being at a computer. I know there's a pretty effective technique that you use, Dr. Bue, for a neck reset. I think on video it might be pretty appropriate to be able to show that one today. Would you be able to demonstrate that on camera? Would that be a problem with you?
Absolutely can demonstrate it on camera. So the neck reset drill, believe it or not, is going right across the base of the clavicle and then across the base of the jaw. The RPR drills are wonderful because they come with something we have to our patients. It's a nice little diagram, and it shows you exactly what wake-up drill to do in what order and where they are on the body and how to do them. So for that neck wake-up drill, they use 2 to 3 fingers on each side and just go right across underneath the clavicle. So they teach you to do 20 seconds on each of these wake-up drills. So across the base of the clavicle and back across this way. Again, this is going to be good for those people spending, now if you're stuck at home, more time on the computer, more time on the phone, looking down with poor posture. So I usually come across here for 20 seconds. And then the last part of the neck wake-up drill is to activate right along the jawline. I usually kind of use the back of my fingers and just rub that pretty vigorously. And this is probably going to look kind of funny with me doing it. But again, doing these for 20 seconds can help reset that neck, because anytime we come out of that perfect posture, all those muscles can start to compensate.
Awesome. And that is a pretty darn effective technique. I had a patient through telehealth the other day that she came in, or I guess logged in with a tension headache and left with nothing because of that technique. And they're looking for like gristly or tender spots along that area. So big thanks for I'm going to say coming online today and chatting with us, Dr. Bue. If you guys have any specific questions or trying to connect, you can look up the Chiropractic Wellness Center of Hudson on Facebook or Instagram or the Google machine. If you guys have any questions for us, feel free to hop on our website, physioorthoperform.com, click the telehealth button, and we'd be happy to go through any sort of evaluation you may need today. So thanks again. Mike, why don't you go and cue our ever popular ending music, and I'll go end this video for us.
Oh, no, I'm not singing this time. I got some messages telling me to keep my day job.
You're not going to sing this time. Well, guys, I just wanted to say thank you guys for having me on. It's been a pleasure working with you guys over the years and referring patients back and forth. I love having people that I can trust and send patients over to that have very similar mindsets to myself.